going to switch gears now to the next speaker, and that is Tracie Edward. Tracie, are you going to share your slides?
Yes, I'll get that going.
Great. So Tracie's experiences as a secondary science teacher led her to become a health and safety activist. Her union experience expanded to workers' compensation, disability issues, political action, and bargaining before focusing once again on the prevention of workplace injuries and illness as a staff member in the Health and Safety Services area of the Elementary Teachers Federation of Ontario as the coordinator. She is an instructor for the Workers' Health and Safety Centre and the OFL's Prevention Link, sits on the OCA Board of Directors, and is a former chair of a day of mourning planning committee. Tracie's work is based out of a provincial union office in Toronto, but she still considers Windsor her home with her partner and 2 children. And today, as you can see, she's going to share with us that the Ontario education sector pandemic response receives a failing grade, lessons in workplace transmission. Thanks a lot. Over to you.
Thanks, Valerie. Before I begin, I need to thank my colleagues within ETFO and the rest of the unions representing workers in the publicly funded elementary and secondary school systems in Ontario. We have been working very closely together, supporting each other. You will see in the presentation that our organizations have coordinated some efforts or ran parallel campaigns. So what is really happening in schools? I will provide some context of where we started and our experience with broken promises over the last year. We will try to uncover some of the numbers and the facts and discuss the barriers that education workers have faced seeking safer workplaces, ending with a few future considerations for health and safety in the public education sector. So these are a few things that we have been dealing with in early 2020. Most significantly, the education sector unions had to push back when some school boards began canceling monthly inspections and health and safety committee meetings. But the Ministry of Labour was supportive when these concerns were raised about meeting the legislative minimums. But the government did not have a plan for schools. Education workers joined the Ontario Federation of Labour in their provincial day of action on June 3rd last year. It was not just the education sector where Ford was failing. On May 19th, the Minister of Education committed to providing school boards with a detailed plan by the fall by the end of June. Shortly after their consultation, they asked school boards to prepare their own safety plans for reopening schools and to plan for 3 scenarios for the upcoming school year. Those were due by August 7th. So when the government released their guide to reopening Ontario schools on July 30th, there was a lot of confusion, especially since it had less guidance than the document that they had shared in June. Another important guidance document about outbreak management was only used as a general reference since it contains significant disclaimer that each situation is evaluated on a case-by-case basis. Throughout this process, union representatives provided input locally and provincially at various tables, including the Provincial Working Group on Health and Safety, which also includes organizations representing school board trustees, directors of education, and principals associations, as well as the Ministry of Education and Ministry of Labour. But it was not a consultation. The teacher affiliates attempted to challenge the provincial guide at the Ontario Labour Relations Board, but the OLRB dismissed the union's case based on jurisdictional grounds without hearing the substantive evidence. So the teacher affiliates held a press conference to share the evidence publicly and continued to make use of this evidence wherever possible. After the OLRB case was dismissed, data was gathered and local or central grievances were considered. The focus, though, was on seeking enforcement of the Occupational Health and Safety Act. The teacher affiliates created a common package of materials to share with locals, to mobilize members and joint health and safety committees, including checklists, proposed recommendations with background information, and letters were sent to senior administration at each school board and public health, expressing concerns and reminding them of their obligations. We continued to promote knowledge activism during this fight. At the provincial working group and with our locals, we discussed the precautionary principle that reasonable efforts to reduce risk need not await scientific proof. Since COVID-19 is a respiratory virus, we considered airborne transmission from the start. We were particularly concerned about the ventilation in the schools. We also pointed out that the SARS Commission report emphasized the need for the involvement of the Joint Health and Safety Committees and the need for communication protocols between the Ministry of Labour and Public Health. Our Labour Board complaint and press releases regularly called for research and transparent evidence-based planning to be reviewed monthly. We also made these requests publicly, including a press release issued by People for Education, which included a number of other parent organizations as well. At our provincial working group meetings, we were diligent at raising concerns and sharing the research directly with staff from all of the ministries involved. Oftentimes, information was presented to us at our working groups after announcements were made instead of before. Opportunities to ask questions were provided, but the government responses were often not reliable. We also heard about the lack of consultation at the Oh, sorry, I just saw something pop up on my screen. We also heard about the lack of consultation at the local level. Some school boards were consulting more than others. Public health in most jurisdictions would only deal with the employer and redirected the union's concerns back to the employer. But locally and provincially, we continued to make recommendations through letters and request meetings with public health. Can you still hear me, Valerie?
Yes,
Yeah,
although
okay.
just to pause, but yes, we can hear you.
I'm just having trouble. I lost control
Oh,
of the clicker to click to the next screen.
yeah, I was having some of that problem too, that sometimes the mouse would do it and sometimes the buttons would do it and not consistently. I don't know. Uh, Try. Are you
Oh,
okay?
yeah,
If it
there.
becomes a problem, I can load your,
Okay.
but I wasn't driving any better, so okay, thanks.
So what's really happening in the schools? Broken promises. OECTA created this video, which is posted on their social media, showing the Minister of Education's press conference. Our members feel like it's Groundhog Day, since we have heard similar words at almost every press conference this year. Oh, now my it's catching up with me. There it is. Okay. What's really happening in schools? It would be great to debunk all of the myths that these precautions are in place, but I'm going to focus on the myth that transmission does not occur in schools. So when we look at all of these layers of precaution, in summary, they have not been fully implemented as promised, and they do not provide the protection intended, even the ones that were added after September. We continue to advocate for these precautions to be provided to all education workers and all essential workers to provide the families in the communities we work. And thank you to OSSTF for this graphic indicating the government received another failing grade for the vaccination rollout. Each time the schools would break, additional time was added to the break to prevent transmission, but classes continued virtually. Special education classes were open in all areas of the province by January 11th, and most northern boards opened fully at that time. When boards across the province slowly reopened, with Toronto, Peel, and York being the last to reopen on February 16th. Today, following last week's April break, special education programs have started to reopen in each board despite the increased risk. And that risk is not just to the staff, but those particular students are often unmasked and medically fragile. Each time the schools have reopened, the government announced some new enhanced safety measures, which education workers perceive as very minimal, since some boards had already been taking those precautions, or some of those precautions are not being implemented as previously promised. This graphic was created by the Ontario Families for Public Education using the number crunching by the Canadian Centre for Policy Alternatives. CUPE and OSSTF represent the majority of custodians in our sector and still do not have the evidence that the money provided was actually used to hire custodians to do the necessary cleaning and disinfection. The money that is being announced for ventilation improvements can be allocated to projects that will happen in the summer and maybe not until December 2021, and not improving air quality in the schools at this time. Much of the money that the provincial government is announcing is either federal funding or permitting the school boards to use their own reserves that had been earmarked for other projects. The education unions agree that the provincial government is not as committed to school safety as they repeatedly say in the media. These are sample graphics from OSSTF and ETFO. At the last joint press conference on April 7th, the teacher unions were joined by CUPE, two parents groups, and another epidemiologist, Colin Furness. He critiqued the government's interpretation of data and provides a lesson on proportions. He also made a comparison to public health interventions where there is a case of lice in a school, at which time the whole class is checked along with their siblings. We test more rigorously for lice than we do for COVID-19. CUPE shared this post on social media, and there is a link to more information about asymptomatic testing that is happening in schools, which is far below what they promised. The numbers. These screenshots are taken from two OECTA videos on social media giving the Minister of Education a failing grade. In this first video, the Minister of Education's references to percentages like 98% and 99% receive a failing grade for intentionally misleading the public. The second video, the government excludes part of the country in order to make Ontario's stats look better, but that can also be seen as failing geography or cheating. When we look at the cases on OSSTF's Facebook post on April 9th, it shows at that time there were 24% of schools reporting a case of COVID-19. The government website that posts these cases has been problematic, with data missing and often delayed. We expressed concerns repeatedly that the website stops posting during any holiday periods, even though that information would reflect the number of cases before the holiday period due to the time delay when individuals are asymptomatic and waiting for results. The government also does not post the data for entire school boards that are closed, even when special education classes continue in those boards. Epidemiologists and researchers have approached the government about improving the data they provide, but a true analysis will likely not occur until after the pandemic. We also have concerns about data suppression related to the occupational illness reports and WSIB claims. So we look for numbers elsewhere, but we know the raw data is coming from the government, and it's somewhat faulty. As Natalie discussed earlier, the Ontario Health Coalition is tracking the data related to COVID cases, not just in healthcare, but in other industries, including schools. Thank you for shining a light onto this information. Schools were highlighted to have significant increases in each reporting period since the end of September, significantly higher rates than the general public. Each time the schools reopened until they were closed again. The Health Coalition also pointed out that the definition of school outbreak has been controversial throughout the pandemic, and as numerous cases in the same school are often not counted as an outbreak unless there is an epidemiological link, which relies on accurate and timely contact tracing. Our members are infuriated when the health unit has said that a case is community spread when they know they most likely were infected at school. These images created by the Ontario Families for Public Education and a high school teacher were using the government's own data and show those increases each time the schools reopened. Many epidemiologists are sharing information on Twitter on a regular basis. The yellow line on this graph shows the cases in schools increasing each time the schools reopened, followed a few days later with the cases in the community rising at the same rate. This graph shows I went back too far there. This graph shows both staff and student cases increasing in the same time periods. On this graph, not only are the cases for individuals under 20 increasing at a higher rate, the epidemiologist added a yellow line to show the incidence rate for only those students identified in schools. The resulting yellow line has a much steeper slope on the graph, which indicates a higher increase of incident rate in the schools. There are many studies around the world showing a correlation between school closure and the COVID rates, listing it as one of the most effective strategies to control the spread of COVID. We do agree with the government that schools should be kept open as long as possible because of academic, social, and psychological impacts, but not at the expense of everyone's physical health and safety, especially when reasonable precautions are not being put in place in the schools. In addition to OCAL's regional risk tool, we are checking many other sources. Ryan Imgren is a high school teacher who is also a biostatistician and has been sharing information in the media. His color-coded charts are easy to follow. Also, howsmyflattening.com is sharing data in an easy to digest format and has an option to turn on the geek mode to identify information in specific health regions. The Canada COVID-19 School Tracker is another useful website which also shows the data according to the school boards across the country and not just by health unit. This graph was taken from Public Health Ontario and is a link, and another link is provided underneath to another website for data analysis. One of the ongoing concerns has been the inability of public health to complete the contact tracing promptly. The purple and green bars on this graph indicate the cases where the link is unknown. How can the government say with any certainty that schools are safe if they do not know where people are contracting this large percentage of cases? Public Health Ontario's website also has data available, and you can make provincial and health region comparisons by sector. This shows schools and childcare settings account for 41% of outbreaks, and those are the ones they're recognizing. In Ottawa and Toronto and some other jurisdictions, this number increases to 50% of the outbreaks. Moving from numbers to the other facts. As I mentioned earlier, during our meetings with the government, we continued to ask them for evidence they were using to make decisions, and we shared studies for them to consider. On January 21st, the media reported that internal government documents showed how Ontario watered down its strategies to keep COVID-19 out of classrooms. This included loosening the symptom screening guidelines for schools and daycares and not being in line with their own advice in government documents, thereby ignoring their own experts. As a deflection, a week later, Doug Ford claimed that Dr. David Fissman had a conflict of interest, even though his involvement in both the COVID-19 advisory table and being an expert advisor to the unions was transparent for months. This is just another attempt for this government to ignore the science by attacking the scientists. Many of the other OCA webinars since last spring have reviewed the evidence for airborne transmission. Although the airborne spread of COVID-19 through aerosols was first acknowledged in the spring and summer last year, Canadian guidance documents outlining precautions to prevent the spread of COVID-19 had not been updated to reflect this. In January, we joined more than 500 occupational health and safety experts, physicians, nurses, engineers, and scientists calling for the federal government to recognize aerosol transmission and more efforts to provide good ventilation and personal protective equipment to prevent the transmission of COVID-19. A follow-up letter was sent in February. On April 14th, the OFL sent a letter to the Premier and the Ministry of Health and the Ministry of Labour, calling on them to protect the workers of Ontario and increase worker protection due to airborne transmission, including proper PPE for essential workers. Last week, 3 significant articles were published by prominent medical journals. The evidence is now overwhelming and undeniable, yet the Ontario government will not acknowledge it. The Public Health Agency of Canada changed their ventilation guidelines in January to acknowledge airborne transmission, but Ontario has still not set standards. Again, we shared the information locally with Joint Health and Safety Committees and the Provincial Working Group. Ontario created a series of, OSSTF created a series of infographics to share some of the information as well. Our various unions have requested evidence of air exchange through assessments or verification with carbon dioxide monitors, better filtration, and portable air exchange units where needed. This leads us to the barriers that we faced. I have mentioned a few barriers already, but one of the barriers we found to improving health and safety protocols in our schools was the Ministry of Labour. The Ministry of Labour visited all school boards in August or September for a consultation visit to discuss implementation of COVID-19 practices. Throughout the year, members used the internal responsibility system, reporting hazards to their supervisor and the Joint Health and Safety Committee, and some made complaints to the MOL. There were members who believed that their work was likely to endanger them, and some decided to exercise their right to refuse unsafe work. Every work refusal was changed to a complaint by the Ministry of Labour because they said that there was no evidence that the hazard existed in the building, which does not acknowledge the large percentage of people spreading the virus when they are asymptomatic. Some elected locals tried to proceed with work stoppages and investigations into dangerous circumstances, but were met with intimidation and management's misunderstanding of the process. The MOL Twitter account and the Minister of Labour regularly share how many orders have been written, but the orders we saw at the beginning of the pandemic were only indirectly related to COVID, such as orders to move a health and safety bulletin board out of an isolation room and orders for safety data sheets and proper labeling of chemicals. More recently, we have seen a halt to orders being written. Even one school board had repeated complaints about chemical safety, including the use of disinfectants not on the approved Health Canada list for COVID, unlabeled spray bottles in an elementary school classroom, and the inappropriate use of a garden sprayer to apply disinfectant in classrooms, yet no orders. For most of the year, the orders focused on directing workers to wear their eye protection, blaming the worker and not the supervisors. Some examples which are indirect success stories, were not related to the MOL support, but because workers stood up for their rights, the employer and public health reevaluated the situation. In some cases, classes were closed until contact tracing was completed or because exposure was uncovered. We repeatedly see comments in the field visit reports that the Ministry of Labour cannot issue orders related to public health directives, even when there is a blatant gap in contact tracing or screening that it is putting workers at risk. We have been increasingly frustrated that the Ministry of Labour, Public Health, and employers are deferring responsibility to each other and no one takes action. Appeals have been filed by the education sector unions about the lack of orders in a number of cases, yet we are finding lengthy preliminary objections from the Ministry of Labour's legal team. One is related to, quote, investigation ongoing, a phrase which we had quickly noticed on many field visit reports in the fall. And many times, the follow-up for those ongoing investigations never occurred. We know the individual inspectors have been given direction, which is inappropriate. Last spring, the OFL wrote letters to the Ministry of Labour managers about this, since it was happening in healthcare and other sectors as well. Ministry of Labour inspectors should be given the authority to write orders they deem necessary. To show you an example of a direction from the Ministry of Labour inspectors, I will show you some quotes that we saw repeatedly on field visit reports throughout the province since they were taken from a provincial template for the inspectors. This statement was on many field visit reports up until the holiday break. The first sentence emphasizes the focus on droplet transmission. The second sentence, there is no current evidence that supports COVID-19 is transmitted through ventilation systems, was infuriating. We were not trying to say that that was why ventilation maintenance was required. Adequate ventilation is required to provide an adequate supply of fresh air or filtered air into the room to dispel the virus. Before I move to the next slide, I will highlight the sections that were removed when the Ministry of Labour updated their template. You will notice, in addition to the second sentence being removed, the last part of the last sentence was removed. Does this mean that there is no longer a requirement to meet all applicable standards and good engineering practices? Here is the updated MOL template language seen as recently as March 29th. You will notice that the first sentence focusing on droplet transmission remains unchanged. And they replace the references to standards with some specific advice. But despite all of our efforts of every education union and locals throughout the entire province, we have still not seen any orders related to ventilation improvements. Sometimes a Ministry of Labour hygienist would ask to see ventilation reports, but the Ministry of Labour inspectors would remind employers of their obligation to share health and safety related documentation with joint health and safety committees. And when complaints were made that the employers were not sharing those reports with the committees, there were never any orders to require the board to provide documents to the committees, and never any orders for assessments. Many equity issues have arisen and been exacerbated by the pandemic. Whether educators are affected themselves or they are dealing with their students' issues, such as appropriate access to vaccinations, technology, childcare, sick days have disproportionately affected some of the families that we work with. These concerns have added the stress levels and anxiety of all of our members, but particularly individuals from those groups affected. ETFO has a number of resources to support members with equity concerns and continues to remain committed to social justice. Throughout the year, frustration built. Educators' extraordinary efforts centered on student learning and well-being, but at the expense of their own mental health. Members' mental health was aggravated every time a government made an announcement before the holiday period and when they ignored the need for preparation time to adapt to new situations. The word pivot is now considered a curse word for most educators. Most glaringly, the February 11th announcement about the postponement of the March break denied members the need for their anticipated break after this long, stressful period. In Ontario, in October 2020, the Canadian Teachers Federation collected data through the Teacher Mental Health Check-in survey. The results detail unbearable levels of stress, anxiety, and a struggle to cope with the demands of teaching during the pandemic. Results showed that close to 70% were concerned about their own mental health. More than 5,000 ETFO members participated in OCA's Pandemic Experience Survey in November and December. For more information, watch next week's OCA webinar with John O'Dyke. The survey outlines the significant mental health impact on our members working in schools and those working at home. So what's next? Well, it was leaked on March 29th that the government is thinking of making virtual learning a permanent option. This was a significant bargaining issue in secondary and now has become a threat to elementary students as well. The education affiliates will be pushing back against this, again with the support of many researchers and parent organizations. This is seen as a potential first step towards privatization. The government is exploiting the situation, known as disaster capitalism. This is one of many topics discussed at the OFL's Education Assembly, which explored strategies for just recovery as we come out of the pandemic. The pandemic highlighted the need for infrastructure investments, which is something the Fix Our Schools organization has been tracking for years, including ventilation and water supply. One positive outcome from the pandemic that everyone agreed to is that solidarity has been built between the union groups and other organizations. As we approach the day of mourning, we need to continue to work together to not only mourn for the dead, but to fight for the living. Many of our members have not yet told their stories, but we have had many education workers ill, some on ventilators, and at least one death of a member and another death of a spouse linked to a workplace transmission of COVID in schools. Thank you for joining us to hear that transmission is really happening in schools, noting the lessons that still need to be learned. We welcome any advice that you can provide and everyone's support in making the school safer, both for students and staff, which will in turn make our communities safer. Please share the OFL guide with any education workers you know. There are links to all the education sector unions' web pages and other organizations for more resources in this guide. To end, I need to thank my colleagues in the education sector and the OFL Health and Safety Committee and our partners at the Workers' Health and Safety Center and OCAL who have provided us with tremendous support over the last year. And also thank you to Elizabeth Mitchell, my coworker. I believe she's been posting a lot of these links in the chat, and I have shared the presentation with OCAL to post on their website afterwards.
Thanks a lot, Tracie. That was a lot of really valuable information. And of course, it makes complete sense that in a congregated setting like a school that there would be transmission and risk. And we really appreciate you sharing your experience and advocacy strategies in trying to protect your members and the other workers in the schools and the students and their families. And the families of the workers. It has a very big impact in society, as you mentioned. So thank you very much. We don't have time for many questions. There was some comments around the failure of the Ministry of Labour to enforce and whether that an appeal to the Labour Relations Board. Elizabeth's been answering the questions, but I don't know if you wanted to add anything else around how successful those appeals might be. And then there was another question about the contact tracing, disregarding or discounting if staff as close contact if they happen to be wearing a barrier face covering and not recognizing there's still a risk there. So those are the two questions of note. If you could quickly answer, and then we'll switch to Tim.
Yes, we don't know how successful our appeals will be. What we do know is that they are going to take a very, very long time. The mediation dates and the preliminary objections, scheduling the hearing dates, it is going to take a while, but we will continue to push forward. We think we have a lot of great evidence, and we will continue to push forward. We did wait a little bit in the school year until the risk was higher, and we gathered all of the evidence that we needed after repeated attempts to use the internal responsibility system. We wanted to make sure we had a really good case going forward, and we do think we have a good case going forward about contact tracing that CUPE brought forward. OSSTF and ETFO have both brought forward cases specific to all of the protocols and really focused on ventilation as well. So we'll see. I know that Katrina's on the line too, and OECTA has some cases going forward as well. And we work closely together on these as well. But yes, I think Natalie said it as well, that if someone's wearing their PPE, the Ministry of Public Health actually considers them low risk, and they often are told to actually not even self-isolate. The teacher in the class and the other education workers in the class, because they had the medical mask on, they are told they can go back to work, even though every student in the class is told to self-isolate, which is very, very frustrating for the staff. And the Ministry of Labor, they won't challenge any decision by public health.
Yeah, thank you. And yeah, the whole concept that a medical mask is PPE and not source control, which is in fact what it's intended for, is the complete mistake in that whole equation, I think. So thanks, Tracie.